Hello everyone. Today our medical discussion, episode number 29. Today our topic is ringworm. So my first question is, what is ringworm and which people are most susceptible to get this infection?
So ringworm, it is a very common infection we see in our OPD. Normally, ringworm is not a worm actually. It is a fungal infection caused by a fungus which is known as tinea, and this usually fall in the category of dermatophytes. So there are a lot of groups of fungi, and this fungus, that is tinea, which is the causative agent of ringworm, it mainly falls under the category of dermatophytes. Normally, tinea, it infects the dead tissues of our body, especially the upper layers of the skin, the nails or the hairs. So it is found, or it can infect our scalp, or in the male it can be seen infecting the beard, or it is seen sometimes in the axillary areas or in the groin areas where it is known as jockets, or sometimes it can be seen in between the fingers where it is known as athlete's toe. But the important thing is that tinea infection is very common in areas which are mainly moist or warm. So these areas are very susceptible to this kind of infection. Normally, tinea or any kind of fungal infections are common in certain groups of people. Especially, it is seen among the children because they come in contact with a lot number of other children during their playtime who are having already this tinea infection. Moreover, it is also found in the people whose immunity is a bit compromised, especially in people who are suffering from chronic diseases, especially diabetes mellitus, chronic kidney disease, any kind of infections or any diseases which lead to a patient to be bedridden. A person suffering from cancer, suffering from other diseases, especially the cerebral diseases like delirium, Parkinsonism, Alzheimer's disease or peripheral neuropathy, where people where this type of diseases people usually get bedridden, and the hygiene of the people, this is usually compromised, and so they are more susceptible to both fungal tinea infection as well as other fungal infections. The people who don't maintain their hygiene, especially people who don't wash regularly, don't bath regularly, especially this type of people are also susceptible to get fungal infections. People who are involved in contact sports like boxing or any sports where there is contact between two people, so this type of people are also susceptible to get tinea infections.
Thank you, sir. Now my next question is, what are the signs and symptoms that can be seen in case of this fungal infection?
So normally fungal infection, there are it can be diagnosed just by looking at the type of the rash. Whenever first of all, I would like to say that the spread of this tinea infection, it is mainly through contact or through wearing of clothes which has got that fungus, or it can be with a contact with a person who is already having that tinea infection, or by using the clothes or other wearables or other things of that people who, like combs, like clothes, or even the contact with the walls or the ground of the people who is already are in contact with a person suffering from tinea infection. So that type of contact also lead to the spread of that tinea infection. So whenever a person get that infection, first of all we can see a rash, a red rash, and there can be certain amount of pimples or certain elevations in that rash. With time, the central area of the rash will be cleared, and ultimately a ring will be developed, and within that ring there can be formation of some blisters, there can be some discharge of pus or discharge of certain sticky material from that ring, and there will be clearing of the central area. So this is the typical rash which can be seen in a person suffering from tinea infection. So by directly looking at the rash, we can diagnose a person suffering from tinea infection. Moreover, if there is certain amount of doubt, we can go for a skin scraping test where a certain tissue or some amount of tissue is taken from that involved area and it is looked under a microscope. Moreover, the skin scraping can be used for to do a culture to look for the growth of fungus, or it can also be sent for a biopsy. These are the various diagnostic method by which we can diagnose tinea infection.
Thank you, sir. So please tell us the treatment procedure of tinea infection.
As we have already discussed that tinea infection, it is very common among the people who don't maintain their hygiene. So the most important thing is to keep the areas clean and dry, because tinea is very commonly the growth is seen in the area which are moist and warm. So we should keep the areas clean and dry. Moreover, we can go for over-the-counter antifungal cream. There are a lot number of antifungal cream like miconazole, oxyconazole, luliconazole, fluconazole. So there are terbinafine, various type of antifungal cream which should be used for a period of at least 4 to 6 weeks, because this type of infection to completely get cured, it should be used, or the medicines should be used for a longer duration. However, if the person is still not cured with this antifungal cream, we can go for antifungal medications. There are a lot number of medications, especially we go for itraconazole, we go for terbinafine. So using these medications for 4 to 6 weeks leads to the complete cure of that person. Moreover, we should know how to use the antifungal cream. So first of all, we should wash and dry the involved area, not by rubbing but by patting with a clean coat. Then we should apply the cream from outer to the inner surface of the rash. So then we should wash our hands, and it's important that we use the antifungal cream consistently, at least twice daily for 7 to 10 days, and no other bandaging should be applied over the area. So these are the common treatments, common medications which are easily available in the, and it can be get over the counter medications, and using these medications, this type of infections can be treated.
So what are the preventive measures of this tinea infections?
So important is the hygiene, because tinea infection, it depends on the hygiene of the person. First and foremost thing is that the clothes, especially the innerwear, should be washed regularly. Washing should be done with a warm and soapy water. Then if possible, every cloth should be ironed before wearing. Moreover, after bathing, if possible, new towels or new clothes should be used to rub the body. Then clean every time we wear new clothes, every time we wear clothes, it should be ironed, it should be washed regularly. Moreover, the people who already are having this type of infection, the clothes or other usables should not be shared, especially the clothes, especially combs or other areas or other things which are used by that person. Moreover, the bath sinks, bathtubs, as well as the floor of the bathrooms which are used by a person who is having tinea infection should be cleaned regularly, because contact with these areas also lead to the spread of this infection. So prevention is most important, hygiene is very important, washing of the clothes regularly is very important.
Thank you, sir. We have learned so many new things regarding tinea infection. So what you like to request or advise to the audience?
So tinea infection, it is a very common infection. Most of the people gets frustrated because this type of infection becomes recurrent. Even if the upper surface of the skin is cleared, again it recurs after some time. So important, hygiene is very important. The regular use of the medication is very important for the recommended duration. Moreover, if a person has any other chronic diseases which compromises the immunity, such diseases should be treated. So if we abide by these methods, if we take the treatment regularly, we will surely we can cure this fungal infection. I hope you all like this video. Please share, please subscribe our channel so that we are motivated to make new videos on new topics. If you have any comment, please write your comments in the comment box. Thank you. Thank you so much.